Hello, I am Dr. Bapuji, Chairman for Center for Integrated Medicine, Hyderabad, India. I am qualified in allopathic system, that is known as modern medicine in Eastern Hemisphere, traditional medicine in Western Hemisphere. I am also qualified in alternative medicine, that is naturopathy and yoga. Now for the last 45 years I have integrated all these three different disciplines and practicing in dealing with most of the chronic problems. Today I am going to talk about migraine. It's a most common problem and wrongly diagnosed. Migraine headache, when patient presents, he or she presents with headache. When I go into the details, they say it starts from here, doctor, slowly it spreads. Most of them have partial headache either in the right portion of the head or left portion of the head, and later on when the migraine headache, so-called migraine headache continues, it spreads to the whole head. Some people have 2-3 hours, some people have whole day, some people have continuous 3 days. They confine themselves into the room, they will switch off lights, they can't tolerate sound, they can't tolerate anybody talking loudly outside the room, they cannot tolerate light. This is a classical presentation. I get cases who have continuous headache, dull headache, for the last few days to few months to 2 years also. Then I get surprised, how could he or she function with this dull headache? Because when they take any painkiller, it subsides only 60 or 70%. 30% headache, heaviness in the head continues. Now this can give rise to irritability, argumentativeness, and they are abusive at home. They cannot abuse the servant maid in India because she is the most VIP person. They cannot scold children or be irritable. It is the only husband who is the victim because he has to go out and work, and she doesn't know or he doesn't know what to do or where to go. They decide to go to ophthalmologist first for refractive error. They get the refractive error corrected, wear the specs, then they go to general physician, MD qualified. He gives some painkillers and tells the patient to come back after 15 days. Then orthopedician comes into picture because the headache also extends here, associated neck pain is also there. Then they go to neurologist also. Each one will do investigations pertaining to their specialty. This is the scenario. Ultimately they will end up here at my clinic. I am the last batsman like Mahendra Singh Dhoni, though he has retired. I have not retired yet. So what happens is, migraine, what is migraine? Let me explain. Migraine headache in medical field, when we investigated, the only thing we could investigate is there is increased circulation to head and neck and brain area. Why? Nobody knows. And migraine, there is no test to diagnose. Migraine has to be diagnosed after ruling out all other causes of headache. What are the other causes of headache? I told you refractive error can cause, sinusitis can cause, then neck can cause headache from behind, spreads to the front. These are the common causes of headache, but nobody questions the patient about the onset of pain and the pattern of pain and what gives them relief. Nobody questions. And they, apart from the medication, confining themselves into room, they will apply pain balm. Their number of pain balms are available, but still no relief. Now I have come here to tell you that if you draw a line from year to year, in front of this line, whichever headache or whenever the headache starts, It is because of sinus. In India, 80% people have sinus problem. They do not know. How do you recognize sinus? Now some people have symptoms. What are the symptoms? Bad breath, which is not given in medical books, sore throat, snoring, then constant phlegm formation in the throat, or some sour to bitter, regurgitation from nose to throat. Early morning they don't feel fresh. These are the symptoms of sinus. Apart from this, they develop dark circles around the eyes, and they develop pigmentation on the face, pigmentation on the cheeks, pigmentation on the sides of the face. When you look at their complexion here and here, there is a drastic change. The face has become dark. People do not notice. They may not have all the symptoms excepting these dark circles around the eyes, and pigmentation is enough to diagnose sinus. 80% Indians have sinus. And Westerners, Europeans, Australians, 99% people have sinus. This is because the amount of dairy products they consume, like cream, butter, cheese, and the amount of non-vegetarian foods like beef and pork, almost every day they have. And in India, the curd and milk products, certain foodstuffs are forbidden in the evening. And they have forgotten. Traditionally, in every community, every caste, region wise, I have compiled these forbidden foods in the evening, and everybody has forgotten that. That increases congestion in the nose, congestion in the throat, snoring, and so on. So what happens is, in migraine, the headache which starts here is because of sinus, and behind this line the neck can cause the problem, because this area is supplied by C1, C2, C3 nerves arising from the cervical spine. Now this has got to do with the posture of your sleeping, and your sitting and lying down, and reading books, and then lying down and watching TV, lying down and watching YouTube or cinemas in smartphones. These are things which everybody is doing. So the migraine has to be diagnosed only by ruling out all other causes of headache. In fact, migraine rarely occurs. Now for migraine in modern medicine, vasograin preparations are given. Vasograin is an extract of bark of a tree, and it is a powerful vasoconstrictor. So by taking vasograin tablet, what happens is circulation to the brain is decreased along with the vasoconstriction of all other blood vessels in the rest of the body. So vasograin, if it is used for a prolonged period, it will cause hypertension, because vasograin doesn't know that it has to constrict only cerebral vessels. It's a wrong notion. So market names are there, I don't want to mention. Then sumatriptan is another drug which has come. All of these drugs are same action. That's how it gives partial relief. And these medicines have to be taken the moment the headache starts. But here the problem is sinus and cervical. That is why it doesn't give relief, and people, after getting fed up, they come over to this clinic. We are putting them on diet restrictions. We are teaching them about how to use a pillow, how to use mattress, teach them spinal exercises, and they carry on these. And we teach breathing, apart from breathing exercises, Jalaneti is a yogic kriya, and with hypertonic salt lukewarm solution. And when they follow mattress, pillow, diet restrictions, Jalaneti in lukewarm hypertonic salt solution, they start feeling much better. We give them initially a mild pain relieving medication, analgesic. I am not talking about NSAIDs, non-steroidal anti-inflammatory drugs. People are liberally using it. Is not correct at all. So any analgesic along with an antihistamine initially If you use antihistamine, the phlegm in the sinuses and upper respiratory tract becomes sticky, and it may solidify in the maxillary sinuses particularly. That may require surgery later. These few things if you follow, you will be cured of your migraine. So-called migraine I am saying. Thank you.